Hello everybody, this is Gary Beck, your naturopath from the Maximum Wellbeing Thyroid Studio. I have today a special guest with me. Sitting right here is Dr. Daryl Turner. So I'd like to thank Daryl Turner for coming in today and offering some words of wisdom about your health.
Thank you for inviting me, Gary. And I think that you just said that we're going to cover autoimmune. So I'd love to get stuck into that.
Indeed, yeah. Yes, that's my question right now is, Dr. Turner, why are we seeing so much autoimmune disease, and what is the basis or the foundation and perhaps one of the key causes of this all too common condition?
Okay, first of all, I'll cover the types of autoimmune disease that you can get. The primary types that are caused by thyroid, Graves, that's caused by hypothyroidism, when your thyroid is too low.
Overactive thyroid, yeah.
Yep.
And I'm sure there's some of you out there that have that going on right now. You know?
The most common form is Hashimoto's, because most people have, 80% of the population have an underactive thyroid, that there's not enough thyroid in their bodies for their bodies to function properly. And the third type is a thing called Hashimoto's, which is quite rare, but I'm coming across it more and more, and that's a combination of Hashimoto's and Graves. So first of all, let's talk about Graves, which is only about 2% of the population, 2% of the autoimmune disorders involve Graves. Graves is caused by an overactive thyroid, and you have to be very careful in the treatment of Graves. We actually have protocols that double the effectiveness of the treatment and reversing Graves that we have developed, but the treatment of Graves is quite difficult. And 1/3 of all people who have Graves end up having a thing called partial ablation. That means that most of their thyroid is removed. Why do we need to do this? Well, Graves can cause a thing called rapid heartbeat. In other words, your heart goes into an uncontrollable fast beat. Don't forget your thyroid controls your heartbeat. So you can go into a rapid heartbeat that you cannot recover from, and it can cause some patients to die. And that is why there is a technical term for it, but that is why you have to have the Graves autoimmune response treated. Now let's talk about Hashimoto's, which is the most common. We find a lot of patients with Hashimoto. In fact, 18% of all the patients in Australia that we treat have Hashimoto's. In India, where we have a fairly big presence, and the Middle East is 25%. Wow. It's a lot higher than here. But why do you get Hashimoto's? Well, one of the big drivers of pushing you towards Hashimoto's is unidentified, undertreated or untreated hypothyroidism. And in other words, your thyroid gets absolutely exhausted. You combine that with lack of iodine, and it simply blows out. You end up with not only Hashimoto's, that is the body attacking your own body, the antibodies attacking your own body and destroying part of your body, which is going to shorten your lifestyle or shorten your life expectancy. And it also triggers other autoimmune responses. The first place it goes to is the digestive tract. And you start getting all these digestive disorders. The next one is your joints, joint effusion, and there's a whole cascade of autoimmune responses that you just don't want to get involved with. But that is all reversible, because in my clinical trials on 2,200 people over 3 years, I accidentally stumbled across how to put Hashimoto's into remission, which only takes us a very short amount of time, and eventually, over a period of 1.5 to 2 years, how to totally cure it. Not only do we cure the Hashimoto's response of attacking your thyroid, but it actually reverses your autoimmune response in your digestive tract, joint effusion, etc., etc. Hashimotosis is the third form where people have both Hashimoto's and Graves'. It's not very common, but we do deal with it. This is a genetic factor. So we run a gene test on you, a DNA gene test, and from that we track down what genes are faulty. There are some very common genes. I won't go through them too much in here, but one is called the foot, and another one is called the IL-6. But these genes are faulty in people with Hashimoto's and Graves'. We're able to treat it. We can't reverse the inherited genes, and we can tell, by the way, whether the genes are inherited from your mother or your father, or both. So you can blame your mother or your father for something once you run the gene test, but we're absolutely able to put it into remission. It is a very difficult condition to put into remission, but we do have the tools and the medications to put it into remission over a 2-year program. The other one I want to mention here is a thing called RT3, reverse T3. Reverse T3 is when the free T3 goes backwards. In other words, instead of having FT3, you have 3TF. The hormone is back to front, and the body doesn't recognize it, and that is caused by adrenal stress. I just want to group that in with the autoimmune responses, because we find this is fairly common actually in Australia. It's a precursor to Addison's and Cushing's, which is a mental and nervous breakdown caused by extreme adrenal disorders. But that's a brief summary of the Hashimoto's, Graves', Hashimoto's, and reverse T3.
Interesting, isn't it? You know, these conditions are affecting a lot of people, and the 18% of the population here is
80% of the 80%.
Yep, in that category. So you know, that's almost 1 in 5 of the general populace is going to be in that category with a potential autoimmune condition affecting your thyroid function. So and one last thing, Daryl, the reverse T3 is a really interesting one, which I've seen a little bit of, and in this modern era where fasting has become quite popular, we know that there's lots of benefits of fasting, but when we have a overburdened adrenal system and then we throw in a period of fasting, that in itself, I think, could actually result in the creation of reverse T3. Am I correct in saying that?
For Hashimoto's, Graves', and Hashimotosis, we automatically put everyone onto a paleo diet. That's step number 1 before we give medications or anything. Those diseases are identified by a blood test, a very definitive blood test called TPOAB and TGAB, and of course the Hashimotosis is a combination of both. We only use intermittent fasting if the patient is overweight as well. We'll put them onto a paleo diet and intermittent fasting, and we have 3 different plans there. For reverse T3, we don't want to put you onto intermittent fasting because it stresses the body further. The RT3 is lifestyle changes, number 1. In other words, how you interpret the incoming stresses, and treatment with a thing called cytomel, which sounds counterproductive, but it's actually a form of T3, which in 30 days reverses the reverse T3 and allows your body to convert properly. But the intermittent fasting we only use for weight control, not for reverse T3.
Yeah, it's one of these really clever feedback mechanisms within the body, isn't it?
Yes.
In a sense, when you when your body's deprived, so if we're doing a prolonged fast, so your body gets the message, oh gosh, I'm not getting enough of what I need, then things shift. Part of that is a positive change for some people in their nervous system and their digestive function, but if it was to go too long for some people, there's going to be this sign, this little thing that comes up in the body and the blood that says, hang on a minute, we're not getting enough, so it actually starts to turn the thyroid on in a different way. So it will actually slow down what's happening in the thyroid to compensate for the lack of nutrients that are coming in.
Correct.
So yes, it's just one of those things to be aware of. I know there's a lot of excitement with the benefits of fasting, but for some people, you need to be aware that it could actually push you into a place where the body compensates for that in a negative way. So is there anything else we need to say about the autoimmune aspect of thyroid, Dr. Turner?
Yes. As I mentioned before, I discovered how to put Hashimoto's, the most common type, not only into remission, usually that takes about 90 days, but how to cure it, how to reverse it, how to reverse the autoimmune responses. I'm very proud to have made this discovery. We're peer reviewed, we're FDA, TGA, CE approved, and we are very proud of the hundreds of thousands of people we have helped around the world to reverse their autoimmune, including my wife. She doesn't like her name mentioned, but today she is 100% free of any autoimmune response because of the protocols that I developed and discovered and put into practice with her. So I'm the beneficial owner, or perhaps not owner, but I'm the beneficial recipient of someone who was suffering terribly from autoimmune, and it has been totally 100% reversed. Mm-hmm. So that's a little personal note.
And I can certainly reiterate, I've spoken with Dr. Turner's wife many times, and when she talks about how she used to feel, yes, it's just one of those places where nobody should have to be. So
night and day.
Yeah, so we feel really privileged to not only have the expertise of Daryl's experience behind us and what we do, but we are able to actually take hold of these things that seemingly can't be treated and actually have them treated for you in a really super effective way. So yeah, it's wonderful and exciting, and hopefully gives you hope if you're in that place of not knowing who to turn to or where to go. We do have options, and I want you to be assured that it doesn't have to be doom and gloom for the rest of your life. So with that, I think Dr. Turner will wrap this one up, and once again, thank you for coming in today.
Thank you, Gary, for inviting me and for allowing me to share my excitement about helping people around the world.